Welcome to the Deep Dive. Today we're tackling something pretty much all of us do, searching online for health information. We've gathered quite a stack of sources here, insights from Joint Commission International on Quality, some serious warnings about Dr. Google, from CureSelect Healthcare and University Health.
Yeah, and even that fascinating Reddit thread from anesthesiologists.
Exactly, discussing medical info versus advice online. So our mission today, really understand the appeal, why we rush to the web with health questions.
And crucially, the real dangers involved.
Yes, the dangers, and how you, the listener, can navigate this whole digital health landscape a bit more effectively for your actual well-being.
It's so relevant, isn't it? We're just swimming in information, but knowing what to trust. Especially with health, that's the real challenge.
It really is. These sources really lay out the double-edged sword here. The pull is obvious, but so are the potential problems. And, I mean, come on. Who hasn't typed a symptom into Google? That little cough, a weird ache, and bam, you're down a rabbit hole.
Oh, yeah. Sometimes it's reassuring, but often.
Often. It's terrifying, right? You're absolutely not alone if you've done that. But the big question is Dr. Google a helpful friend or maybe a riskier acquaintance? Let's unpack this.
Okay, let's do it. The allure, the pull of Dr. Google, it's undeniable. Our sources really hammer home just how common online self-diagnosis is now. I mean, look at this. CureSelect Healthcare mentions a Canadian survey way back in 2013. Over half had Googled symptoms.
Over half, even then.
Right. Then fast forward to 2020, same source says 69% were using the internet for health info. And University Health backs this up too. They cite a 2013 Pew study over a third of Americans self-diagnosing online, and they rightly point out that number is almost certainly much higher today.
It's just staggering, isn't it? A massive shift in how we approach health concerns.
Yeah.
Often, like you said, before even thinking about a doctor.
Exactly. And the why is pretty clear when you look at it.
Yeah, the sources break it down. University Health, CureSelect, they both talk about just how easy it is. Our phones, tablets, they're always right there.
Instant access.
And convenience. No appointments, no travel, no sitting in waiting rooms.
That's a big one. Plus, the perceived cost savings. University Health mentions high deductibles, co-pays.
Right. And CureSelect notes, in places like India, using online info maybe for over-the-counter stuff, is sometimes seen as a way to dodge consultation fees.
Yeah, and there are psychological factors, too, which CureSelect touches on, like feeling more in control of your health, maybe?
Taking that first step yourself.
Right, or even believing it helps you explain symptoms better to a doctor later on.
Okay, I can see that.
And, for people with chronic conditions, the web can seem like this constant source of guidance.
That makes sense. But it's really interesting seeing the doctor's perspective, like in that Reddit thread you mentioned.
Oh, yeah, the anesthesiologists.
They draw a really sharp line, don't they, between medical advice, diagnosis, treatment, and just general medical information.
They do. There is a real debate there about keeping their forum professional, not letting it become a place for us lay people seeking diagnoses.
So the internet gives you facts, maybe, but it can't apply them to you. That's the key difference. That's the doctor's job.
Precisely. It highlights their concern about context. Facts without the individual picture can be misleading, easily misapplied.
Which leads us right into the risks, the pitfalls.
Exactly. This is where it gets, potentially dangerous.
Okay, so let's dive into that. Because, yeah, convenience is great, but our sources are really clear about the downsides. The core issue, and Supreme Medic Consultancy, University Health, Suncoast Surgical Associates all hit this point hard. Search engines just don't know you.
Right. No history, no lifestyle context, none of that nuance.
All the stuff a real doctor considers. And that's just the starting point, isn't it? The lack of personal context.
It is. Then you have the information itself. University Health, general warnings. They all stress how much inaccurate, frankly, misleading stuff is out there.
Like where? What kind of sources are we talking about?
Well, Wikipedia, personal blogs, forums, places where literally anyone can post anything, whether it's right or wrong.
No vetting.
None. CureSelect points out how hard it is to sift through that, find reliable sources, and, worryingly, false health info. It spreads like wildfire online.
Yeah, and it feels like the algorithms almost help it spread sometimes. Informatica notes this. They prioritize popularity, clicks, not necessarily accuracy.
That's a huge problem, and social media gets flagged, too, by University Health and CureSelect. Think about recommendations driven by, money.
Selling something.
Exactly. Or secondhand diagnoses on social media with who knows what agenda behind them. CureSelect calls that out as particularly risky. It's quite alarming, actually.
It really is. So you've got bad info spreading easily, and search engines aren't necessarily helping you find the good stuff.
And it completely lacks that individualized element. Think about how a doctor works. University Health, Supremedics, Suncoast Surgical remind us they weigh your history, lifestyle, specific symptoms, even local health patterns.
Yeah. Google gives you the generic version.
One size fits none, often.
And what about the psychological side? The anxiety?
Ah, yes. Cyberchondria.
Yeah.
CureSelect, University Health, Informatica, they all talk about this. That obsessive searching that just ramps up the worry.
Creating cycle, right. Search, worry, search more.
Exactly. Based on information that's often misinterpreted or just plain wrong for your situation. The Supremedic script really paints a picture of going from a simple symptom search straight to panic mode.
Finding the rarest, scariest diseases first.
Pretty much. And what happens then? What are the real-world consequences of that anxiety? Or worse, a wrong self-diagnosis?
Well, CureSelect gives that scary example. Thinking you have a stomach bug when it's actually appendicitis. Delaying critical care.
That's terrifying. Or becoming so convinced of your Google diagnosis that you argue with your actual doctor. CureSelect mentions that too.
Stubbornness based on, 10 minutes of searching?
Right, and the Supremedic script raises the opposite fear, ignoring serious symptoms like heart attack, because you've convinced yourself it's just gas or something minor you read about.
So it cuts both ways, missing serious things or stressing out unnecessarily over minor things.
Both are bad outcomes. Our sources warn about delays in getting proper treatment across the board.
Okay, and then there's self-treating. That seems like a whole other layer of risk.
Oh, absolutely. CureSelect and the Supremedic script strongly caution against grabbing over-the-counter meds or trying home remedies just based on an online guess.
Without a proper diagnosis first.
Precisely. Supremedic specifically calls out self-medicating with things like antibiotics, painkillers, even herbal stuff without talking to a professional.
Which can be directly harmful, right? Or just delay getting the right treatment.
Yes, and CureSelect adds another crucial point, antibiotic resistance. Using antibiotics when they aren't needed contributes to that huge global problem.
Plus mixing medications. Supremedics warns about that too. You find different advice online. Try combining things.
Without understanding interactions or side effects, it's incredibly risky.
And CureSelect adds that point about unreliable info on meds and supplements online, especially maybe in less regulated markets.
Yeah, so while the information is out there, relying on it for diagnosis and treatment, it's just fraught with peril.
Okay, so we've definitely established the risks. Blindly trusting Dr. Google, not a good idea. But like you said, the internet isn't going away. CureSelect acknowledges that online health info is just part of life now.
It is. So the question becomes, how do we use it safely? When can it be helpful?
Right. And how can you, the listener, navigate this whole thing more wisely?
Well, the consensus from our sources, CureSelect, University Health, the Supremedic script, seems to be that Google can be useful, but mainly after you've got a diagnosis from a real doctor.
Okay, so use it for follow-up information.
Exactly. Learning more about your condition, understanding it better, apparently that can actually reduce stress sometimes.
Makes sense. You know what you're dealing with.
Right. Supremedic also suggests it's good for looking up lifestyle changes, home care advice, understanding meds your doctor has prescribed.
Or finding verified hospital websites, helplines, that sort of practical info.
It's about using it as a tool to support professional care, not replace it.
So if you are going to search, what are the smart ways to do it?
Check your sources. That's number one. CureSelect stresses this heavily.
Look for
reputable places, well-known hospitals, established medical groups. Websites ending in .gov or .org are usually more reliable, as CureSelect and University Health point out.
Supremedic even gives examples, right? Like AIMS, NHS, Mayo Clinic.
Yeah, trusted institutions. And be really wary of sites pushing miracle cures, trying to sell you stuff directly.
Quoting sketchy sources, asking for money.
Exactly. CureSelect lists those red flags, and University Health adds, don't rely on just one source. Cross-reference with multiple reputable organizations.
Good point. And maybe the most important thing University Health suggests, use what you find online as, like, homework for your doctor's visit.
Yeah. Note it down, bring it up. Use it to start a conversation, not end one.
Okay, so that's how to use search better. What about alternatives? Smarter first steps than just Googling symptoms.
Well, technology offers some good ones. Patient portals, for instance. Cure Select and University Health mention these ways to message your doctor's office with non-urgent questions, maybe get refills.
Without a full appointment sometimes.
Right. Nurse hotlines, too. University Health talks about their 247 line where you can talk through symptoms with an RN.
Get advice on whether you need to be seen.
And telemedicine is growing. Cure Select mentions India's e-Sanjivani for remote consults, great for rural areas. They also mention state hotlines for advice.
University Health points to telehealth visits, too. Sometimes a diagnosis can happen based on description.
And government-verified health apps. Supremedic mentions some specific Indian examples, can provide reliable info and service links.
And sometimes the simple ways are best. Supremedic makes a great point. Just calling your doctor, even a quick call.
Often way more useful than hours down a Google rabbit hole.
Yeah. They also suggest keeping a symptom diary, tracking things.
Which gives your doctor really valuable concrete information when you do see them.
So track your symptoms, maybe use a patient portal or nurse line, or just call the doctor's office.
Absolutely, because ultimately every single source we looked at comes back to the same fundamental point. You need a qualified healthcare professional for diagnosis and treatment.
No substitute.
None. Supremedic, University Health, Suncoast Surgical, they all say, even for simple stuff, get it checked out properly. And like the general warnings say, once you do have a diagnosis, stick to reliable sources like Medline Plus for follow-up info.
Okay, so let's wrap this up and bring it back to you, the learner.
Yeah.
What are the key takeaways from this deep dive?
Well, first, the don'ts. Don't assume Google's a doctor. Please don't panic based on the scary stuff you find.
Definitely don't start taking medicines without talking to your doctor first.
And don't ignore serious symptoms hoping they'll just vanish based on some online reassurance.
Right, and the do's.
Do use search engines carefully for background information after you have a diagnosis.
Do trust licensed doctors and their training.
And do track your symptoms. Ask for help early if you're concerned.
Yeah, it boils down to that, doesn't it? Dr. Google can give you information, maybe, but it's never going to replace that personalized care, the judgment, the expertise of a real medical professional.
Never. Medicine is a science, as Informatica puts it. It's evidence, context, individual care, not guesswork from an algorithm.
So here's that final thought for you to mull over. In this world just saturated with information, how do we get better at critical thinking? How do we learn to spot reliable health advice versus, well, noise?
And maybe more importantly, how do we recognize when we absolutely need that human expertise, that personalized care for our health?
Maybe check out resources from places like JCI or NABH on healthcare quality standards. Or even look into those AI symptom checkers. Informatica mentioned, are they a better first step than Google? Still not a doctor, but maybe more reliable.
Interesting questions to ponder. Join us next time on The Deep Dive, where we'll be exploring the importance of getting a second medical opinion.
Until then, please prioritize talking to your actual healthcare professional over falling down the tempting but often treacherous online self-diagnosis rabbit hole.